chronic pain is something that unless you've had chronic pain, you can't understand it, because a normal healthy person, you'll you'll fall and get a really bad bruise, and then it'll be really sore for like a week, and then it goes away and you go about your business. But when you have chronic pain, you never get to go about your business, because the pain doesn't go away. It it just pulls up a chair and sets up a little flag and plants itself and claims part of you for itself and doesn't let go of it. For my pain, I take gabapentin, which it was originally designed to be an anticonvulsant and used for seizures, but now they generally use it for nerve pain because it just works better for that. So, and it's prescribed for the nerve pain, but it does seem to really be treating my flushing. But I also get it like down my arms and my chest and the tops of my legs and my hands, and it just feels like my entire body is on fire, and I absolutely, it was just horrendous. So gabapentin has helped a lot with that. So um, I would actually want to continue taking it even if my nerve pain got worse. I think I would prefer to have nerve pain uh, than to have that flushing come back, because that was horrible. So I'm on that, and I also take Flexeril, which is a muscle relaxer, and the combination really does seem to help. Uh, I get some breakthrough pain, especially when I'm not taking it regularly, but even when I do have pain, it's not as severe as what it is without any medication. The Percocet worked for a few days, you know, but then it started, like I said, the digestive issues. I was feeling nauseated even more than usual. And nausea is one of my recurring issues, but usually when I take my medicine, my Meclizine, it takes care of the problem. However, after I went on the Percocet, um, my nausea meds did no good. The nausea stayed. So, plus I was sleeping a lot, which I sometimes do anyway. But I do think the Percocet was exacerbating that. I did sleep for about like the last 2 weeks. I have been awake maybe 4 or 5 hours every day. Not even, usually not at the same time. Sleep for 6 or 8 hours, wake up for an hour, and I just feel so exhausted and sick to my stomach. I just have to go lay back down and go back to sleep. It's hard to describe sometimes, because unless you've had some nerve pain, it's just so unimaginable. I get it in different areas, and it feels different in those different areas. I get stabbing pains all over, and it literally feels like someone is stabbing you. Like you could almost, you'd put your hand over it, almost expecting to feel the warm rush of blood, because it's that intense and real feeling. And I get those often in like my upper legs and in my head. And when it's in my head, that is just probably one of the worst, because it just kind of overwhelms you and overpowers you. And for those brief few seconds when you have that, you can't think. It's hard. You don't think. You don't breathe. It's this feeling that your head is being cleaved in half, and it's just so unimaginable. It's just terrible. One of the worst sensations I've ever had, and I'm glad I don't get those much anymore. Sometimes my fingers, they get numb and tingly. Uh, and it's very strange, because it'll be just the fingertips that feel like horrible, like pins and needles, and numb me. But then if I touch it like that, it'll go away. But if I open it back up, it starts again. So it's really strange that just having a little bit of pressure on those points and the feeling goes away. I don't really understand that. It's just something weird that happens. I get a lot of pain in my joints as well. Um, and sometimes it's just regular pain, like just like stiffness and soreness. But a lot of the time, I get some really weird sensations, like there's something wedged in the joint, and like a chisel, is being wedged in the joint, and then something else comes along and hits it with a hammer, so that it feels like it's separating, and then the pain radiates away from the joint. That is one of the weirder ones. Um, Sometimes it kind of feels like there are rubber bands inside there and they're pulling on them. It feels just this sensation of being stretched. Um, my hip, my hip pain is very, very strange. Not only does it hurt, it actually sometimes feels like the joint has moved. Like I'll be standing, and when I stand, it actually genuinely feels like the hip joint has slid down into my butt, like my buttock, and is like pressing against the skin, and it's about to rip through. Um, that one, we call that my butt hinge, and it feels absolutely bizarre. Um, Aside from that, my hip also sometimes it feels like it's full of marbles, and just like a big sack of marbles, and it's kind of moving and grinding on each other. And when they move, and bits of my skin and just my innards get caught in between the marbles, and when they're grinding, that's one of the kind of grosser ones. Just because that the sensation of grinding is so tangible and visceral, it just kind of makes your stomach turn just because you can almost hear it grinding. It's really um, very unpleasant. So, so. Oh, allodynia. Yes, the pain response to pressure. I have that pretty badly. Like any amount of pressure anywhere causes pain, but most especially like in my chest, like I have more than one, in my chest above my breasts. And then like in my back, my lower back, kind of where my butt hinge is. So, and it really sucks your soul. It sucks your soul straight out of you. It just shaves off bits of your sanity and well-being. Just, and it's difficult to come to terms with that, and just the reality that this is probably going to be my life for the rest of my life. I'm not quite 30, which means I could conceivably live another 50 years, and it's gonna be like this